Class 1 agents act by blocking voltage-dependent sodium channels. They slow phase 0 and lengthen the effective refractory period. Class 1 agents produce a frequency-dependent block, which means the block will be depending upon their use. During diastole, when the sodium channels are closed, Class 1 agents dissociate relatively slowly, less than 5 seconds, and so, if the frequency is high, drug is still bound to the channel, which therefore cannot contribute to the action potential. For memorizing Class 1 drugs, a mnemonic is used. Queen proclaims Dissose pyramid, where it stands for quinidine, procainamide, and disopyramide. Disopyramide is mainly used orally to prevent recurrent ventricular arrhythmias. Disopyramide has a negative inotropic action and may cause hypotension, especially intravenously, and aggravate cardiac failure. Other side effects include nausea, vomiting, and marked anticholinergic effects, which may limit its use in men, causing urinary retention. Procainamide is similar to disopyramide, but has less antimuscarinic action. It is given intravenously to treat ventricular arrhythmias, especially after myocardial infarction. Class 1C agents dissociate very slowly from sodium channels, from 10 to 20 seconds, and strongly depress conduction in the myocardium. We have a mnemonic for their names too. More fries please, meaning morosizine, flecainide, and prophanon. Flecainide is mainly used in the prophylaxis of paroxysmal atrial fibrillation, but it has a negative inotropic action and may cause serious ventricular arrhythmias. Class 3 agents act by slowing repolarization of phase 3 and prolonging the action potential and refractory period in all cardiac tissues. You can remember them by mnemonic SAD, meaning sotalol, amiodarone, and doflotide. Amiodarone has blocking actions on several channels, for example potassium and inactivated sodium channels, and beta-adrenoceptors. Amiodarone is often effective when other drugs have failed, but its long-term use is restricted to patients in whom other drugs are ineffective because it may cause serious adverse effects, including photosensitivity, thyroid disorders, neuropathy, and pulmonary alveolitis. Sotalol has Class 3 actions as well as Class 2 beta-blocking actions. It lacks the side effects of amiodarone but has the usual side effects of beta blockers.